Hi, I'm back with Dr. Magarelli from C&Y Fertility in Colorado. He's a medical doctor, PhD in nutrition. He's a reproductive endocrinologist, advisor of the American Board of Oriental Reproductive Medicine, and has also published research on combining acupuncture in an IVF setting to show increase in pregnancy outcome. Dr. Mag, for women that are in their IVF process and they're very close to a retrieval or transfer, whether fresh or frozen for that transfer, what is your preference if they're going to get vaccinated or do their booster and it's close to their retrieval or transfer date?
I would say hold. And the main reason I would say hold for, let's say that 4 days would be essential. Well, we've talked a little bit before about not doing it immediately after the transfer, but you don't want to confuse the practitioner, the doctors, into thinking you have COVID because of the response to the vaccine itself. So it's really to treat the doctor, and really to treat the anesthesiologist, and really to treat the nursing team. In a way, we don't want you sick. And by the way, it isn't good if you're febrile from any reason to do a transfer. Don't do it, whether it's from a cold or from an infection. You don't want to be sick during your transfer, because the body's job at that point is to protect itself against some sort of attack. And believe it or not, and I know people find this hard to believe, an embryo is a foreign body. It is not yours. Thank God we're not doing cloning. So that embryo is considered foreign. Now, luckily, the uterus is a nice place that accepts foreigners. It behooves the person to be in the best physical status during the transfer. So the reason we may recommend not to do it just before is not because it's going to hurt the baby or hurt the pregnancy or hurt the chances of pregnancy. It's really because of the reaction of the body to the actual short-term reaction to the booster or to the vaccine. So a week before is great. If you're doing a frozen transfer, do it before the frozen transfer. If you're doing a fresh transfer, do it before. Or if you've done a transfer or just had a transfer, wait a month.
So I want to repeat that, because you're saying do it before the transfer, but you're saying do it at least 5 days before the transfer.
Correct. A week before.
A week before. And just so you don't confuse the practitioners thinking you may be sick, and just so the body is there for uterine receptivity versus fighting the virus or not. Okay.
Correct.
That'll help people, because I just had a few women where, hey, my booster's up and I have my transfer in a week. And so for that woman, you would say, do it today because you're allowed to. And if somebody says, hey, my transfer is in 2 days and my booster's up, you would say, maybe wait for a month after transfer.
Correct. And that's mainly because we want you pregnant. Yeah. If you're not pregnant, get it that day. Yeah. You know what I'm saying? But we're giving the benefit of the doubt to the growing fetus of the fact that we don't have a perfect science about this, and we never will.
And as more data comes out, how you counsel patients around this may change.
Absolutely. Absolutely.
All right. Thank you very much, Dr. Mag.
My pleasure.